know that you said you were not interested in a colonoscopy at this time, but I just wanted to explain the bigger picture so that maybe you can understand why we ask patients to get a colonoscopy starting at the age of 45. Colon cancer is one of the most common cancers, but when it's caught early, it is easier to treat and outcomes are often much better. The screening colonoscopy helps to find cancer before the symptoms show up, so it's a preventative step. And even if you feel fine now, colon cancer can develop quietly, and by the time the symptoms appear, it might be harder to treat. A colonoscopy is a test where a doctor uses a long, flexible tube with a camera on the end to look through inside your colon or your large intestine. And during this test, they can check for growths, which are usually called polyps, or early signs of cancer. And if any polyps are found, then they can often be removed during the procedure, which is really beneficial because that can help prevent cancer from developing. Other options for screening, if you're not comfortable with the colonoscopy, is a stool test that checks for hidden blood in your stool, and it's usually done once a year. It can be an early sign of colon cancer, the blood in your stool, but it can also be due to other things. So that's why a colonoscopy would be more accurate, because blood in stool could be other things, not just colon cancer. You might have heard of the Cologuard test, which is a stool DNA test looking for genetic changes in your stool that could signal colon cancer. It's done at home, and you can mail it in, and you only need to do it every 3 years. But again, this test is not as accurate as a colonoscopy. And if you had high risk, which I know that you don't, like if you had family history of colon cancer, then we wouldn't recommend the Cologuard test. You could also get a CT scan of your colon, which is less invasive, but if any abnormalities are found on the CT scan, then you most likely would have to get the traditional colonoscopy. So we already talked about the benefits of a colonoscopy, but there is a small risk of bleeding or getting a tear in your colon during this procedure, which is really rare, but it can happen. And I understand that no one likes the idea of a colonoscopy, but the decision to screen for colon cancer is an important one because due to the high risk of cancer and your age, while alternatives like the stool test that we mentioned are more convenient and less invasive, they may not catch every case. So the colonoscopy, while more involved, it offers the best chance for early detection and prevention. And if you're still unsure, we can talk more about the other options, or you can take some time to think about it more. But the goal is just to make sure that you're in charge of protecting your health, that you make a decision that we're comfortable with, and we can find a screening plan that's best for you. Thank you.